Hi there, it's me John, and it's been a while since I posted my last video tutorial, and this time I'll be having my voice over because I'll be talking about electrocardiography. Okay, so I hope that before you will play this video clip, you're able to watch the previous videos that is something to do with an introduction about cardiovascular system, wherein I mentioned the different waves in your ECG. Okay, so for this clip, I'll be teaching you how to read the heart rate of the patient in your ECG strip. So just an overview. Now remember that this is your heart, right? Let's try to identify the structures. Now, your heart has actually four chambers, right? The right and left atrium, the right and left ventricle, correct? This is what we call the superior vena cava or superior vena cava, inferior vena cava or inferior vena cava, right? Okay, now this is the right side of the heart. Remember that the right side of the heart receives and pumps unoxygenated blood. Now, because it is unoxygenated, it needs to go to the lungs, right? So from the right ventricle will pump the blood going to your lungs for oxygenation, right? So once oxygenated, your oxygenated blood now is pulled to your pulmonary veins. Here, these are your pulmonary veins. Okay, where subsequently the pulmonary veins are connected on the left side of the heart. That is why the left side of the heart receives and pumps oxygenated blood. Kasi nga po, yung blood that enters the left side of the heart, kagagaling lang sa lungs, and therefore it is oxygenated. The left side of the heart, particularly the left ventricle, will pump the blood out, goes to your aorta, and to be distributed in the different parts of the body. Now, reminder that if a patient is having COPD or it's chronic obstructive pulmonary disease. I'm sorry, I keep on saying coronary because I just had my online class kanina about coronary artery diseases. Anyway, let's go back. I mentioned that the right ventricle pumps blood going to your lungs. That's very simple. If you have COPD problem, when you say COPD stands for chronic obstructive pulmonary disease. By the way, the new name of COPD is your CAL. That is your chronic airflow limitation. One good example of your COPD is your emphysema. Another is your chronic bronchitis. Now, if you have COPD, remember that one complication of your COPD is hypercapnia or an increase in the carbon dioxide. Now, remember, if there's too much carbon dioxide in the body, the effect of hypercapnia in the pulmonary vessels is actually pulmonary vasoconstriction, or in short, the blood vessels in the lungs will constrict. So having said that the blood vessels in the lungs are constricted, so what will happen is that the right ventricle now will have a hard time to push the blood to get inside the lungs because the blood vessels in the lungs are constricted, right? Because of an effect of hypercapnia. Therefore, when the right ventricle pumps the blood to enter the lungs, they will have a hard time to get or to pass through. They will have a hard time to get inside the lungs. So as a result, it increases the workload now of your right ventricle. Remember, the rule in your anatomy, any part sa katawan ng tao na parating ginagamit or, shall I say, increase ang workload, lalaki siya. So the complication there will be right ventricular hypertrophy, right? Or enlargement of the right ventricle. Now, the enlargement of right ventricle is brought about by pulmonary problem, specifically your COPD. Now, what do you call that condition? You call that condition as your cor pulmonale or cor pulmonale. What is cor pulmonale? Cor pulmonale refers to enlargement of the right ventricle due to respiratory problem. That is why, if in the ECG of the patient or in the chest X-ray of the patient, it reveals enlargement of the right ventricle, you suspect pulmonary problem. Okay? Now, having said a while ago that the left ventricle pumps the blood going to the systemic circulation, right? Now, if you have uncontrolled hypertension or persistent elevation in the blood pressure, the systemic pressure is so high. Therefore, the left ventricle now will have an increase in the workload or demand to push the blood to get out from the heart to be circulated in the systemic circulation because of increased vascular resistance. Now, why do we have increased vascular resistance? Because of the pressure that is so high. Therefore, if you have increased pressure in the systemic area, it increases the workload of the left ventricle to pump harder just to promote ejection of blood out from the heart. Therefore, it eventually leads to left ventricular hypertrophy. Kaya nga, if in your X-ray or in your ECG, it reveals left ventricular enlargement, you would suspect hypertension. That is why patients who are hypertensive, they must adhere with their with their maintenance antihypertensive drug, because that is one common concern. Mga pasyente natin dito, pag if they're feeling okay, na they won't take maintenance drug. Remember, you still have to take maintenance drug even if you feel okay, except for if you have hypotension, because of course you cannot take antihypertensive drug if you are hypotensive. Okay, so anyway, okay, the cardiovascular system, they work hand in hand with your respiratory, right? If you can still remember, this is the overview of your cardiovascular system. Now, as mentioned, they work hand in hand with your respi. With your chest expansion, it promotes lung expansion, right? Of course, air gets inside, air gets out. Let's have a closer look. Now, this is actually the heart, the superior vena cava, inferior vena cava. This is what we call the arc of aorta, the descending aorta. Can you see the blood vessels there? These are what we call coronary blood vessels, or the coronary, the coronary arteries. This is the posterior part. This is the right atrium, the coronary blood vessels. Now, just a reminder that the coronary arteries are situated outside the heart. It's just like it envelopes the heart. Therefore, the implication here is that if a patient is having coronary insufficiency, just like your myocardial infarction or heart attack, okay, if the coronary arteries are situated outside the heart, the first layer of the heart affected in coronary insufficiency is the endocardium. That is why if you have an infarct and it is only located in the endocardium, so you call that your subendocardial infarct. Now, why is it that the endocardium is the first layer affected? Because the coronary arteries are located outside. Remember the rule? If there is obstruction in the blood vessel, those tissues or cells located distal to the obstruction are first layer or tissues affected. And since the coronary arteries are situated externally and endocardial layer is the deepest layer of the heart, therefore we can say that in form of coronary insufficiency, it is your endocardium layer first or initially affected of coronary insufficiency. So you call that infarction as your subendocardial infarct. But if the infarction goes beyond endocardium, it affects myocardium or the outermost layer. You call this your epicardium. You call that type of infarction now as your transmural infarct. So again, subendocardial infarct affects the endocardial layer. Transmural infarction goes beyond your endocardium. Okay? So anyway, so I need to stress here your electrocardiography. So your ECG is actually a test that records electrical activities in the heart. It's very clear. It records electrical activities because common mistake is that they associate electrocardiogram as a test that records contraction. Remember, your ECG will not record contraction. It records electrical activities. And of course, common sense will tell us that if there are electrical activities, they may cause contraction. Am I right? But again, it will not record contraction. It records electrical activities. I think I mentioned this in the previous slides. So anyway, let's proceed. I will no longer discuss the different waves because I mentioned that in different slides. Let's proceed now to your ECG strips. Hold on. Okay, now this is actually your ECG strip with, of course, the different waves, right? So let's identify the waves. So this is what they call the P wave. Am I right? This is your Q, R, S complex, and then this is your T wave. You won't have a hard time identifying the waves because naka-label naman siya. All you have to do is just to read and identify. So this is the P, your Q, R, S, T. Now, remember, okay, that the different waves are actually written in an ECG strip. Now, your ECG strip is composed of small boxes and big boxes. Remember, it is your big box wherein the borders are always darkened. So please do not forget that. The borders of the big box are darkened. This will be your small box. Now remember, one small box is equivalent to 0.04 second. Therefore, if one small box is 0.04 second, what about one big box? Remember, one big box has 5 small boxes. Look, 1, 2, 3, 4, 5. Therefore, if one small box is 0.04, what about one big box? 0.04 times 5. So if you multiply that by 5, the product is 0.20 second. That is why one small box is 0.04 second, one big box is 0.20 second. Now what about if you have 2 small boxes? 2 small boxes will be 0.04 times 2. The product will be 0.08. Can you follow? Now, what about 3 small boxes? 3 small boxes will be 0.12 second. Now, why is it important for us to identify this? Because remember, part of your ECG reading is to check the PR interval and the QRS complex. By the way, okay, the normal heart rate of the patient ranges from 60 to 100 beats per minute. If the heart rate of the patient is more than 100, you call that as your tachycardia. If the heart rate of the patient is less than 60, you call that as your bradycardia or bradycardia. The normal PR interval is 0.12 to 0.20 second. So if it is 0.12 to 0.20 second, how many small boxes is that? Well, it is about 3 to 5 small boxes. The question, where is your PR interval? Your PR interval will start from here, okay, going here. This is your PR interval. Can you follow? So how many boxes is that? It's your 3 small boxes. 1 small box is 0.04. So there are 3 small boxes. 0.04 times 3, it's 0.12. In short, it's 3 to 5 small boxes. That's your PR interval. Now, if your PR interval is prolonged, you would suspect AV block. Am I right? Anyway, let's proceed. The normal QRS complex is 0.08 to 0.12. So if it's 0.08 to 0.12, how many small boxes is that? Well, it's 2 to 3 small boxes. So this is your QRS. Am I right? So it's your QRS complex. So how many boxes? 1, 2. So 0.04 times 2, it's 0.08. So that will give you 2 to 3 small boxes. So please do not forget the values. Okay? Now let's proceed. Let's have a closer look with the ECG strip. You need to understand your ECG strip. Okay, now here. This is an ECG strip. Am I right? Hold on. This is an ECG strip. I mentioned small boxes and the big box. Remember, I said that the borders of the big box are always darkened. If you try to check the ECG strip here sa taas, okay, may lumalabas na kudlit. Right? Here. See this part? That one? So, that line until here, this is equivalent to 3 seconds. Can you follow? So, kung dalawa yan, that will be 3 plus 3, this will be 6 seconds. Kaya, you need to know, kay saan yung 6 second strip. So, 3 plus 3, that will give you 6 seconds. Right? Please do not forget that. Now, as mentioned, for this clip, I'll be teaching you how to read the heart rate of the patient using an ECG. By the way, a standard ECG has 12 leads, right? The 12 leads. Now, among the 12 leads, the most important lead there, okay, is actually your lead 2. Now, why is your lead 2 the most important? Because the lead 2 is the most stable lead. That is why sometimes, okay, you will encounter in the doctor's order 12 lead ECG with long lead 2 strip to chart, right? Now, why is long lead 2 so important? Because among the leads, as mentioned, this is the most stable. Having said that lead 2 is the most stable, ito po yung lead na titingnan mo if you want to identify or check dysrhythmia or arrhythmia. This is also the lead that you want to check, that you will check if you want to know the heart rate of the patient. Why? Because of its stability. Okay? Now, when I say heart rate of the patient, but this is actually sample, mga page po na aking libro, The Chronicle of MedSurg. So more of the lectures can be seen, okay, can be found in the textbook, my review notes, The Chronicle of MedSurg. So one way, actually there are 2 ways how to read or identify the heart rate of the patient. First is to use the 6 second strip, right? Remember in your 6 second strip, remember natin 3 seconds, another 3 seconds, so that will give you 6 seconds, right? So question, how will you know the heart rate of the patient using a 6 second strip? Well, you have to count how many R waves are there in the 6 second strip. So if this will be your 6 second strip, remember, from this point to this point, 3 seconds, this point to this point, 3 seconds, that will give you 6 seconds. As mentioned, you have to remember, you have to count how many R waves are there inside the 6 second strip. So this is an R wave, 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 right? So all you have to do is actually to count how many R waves are there. So look, it's 1, 2, 3, 4, 5, 6, 7. So there are 7 R waves in a 6 second strip. You multiply that by 10. Why will you multiply that by 10? By the way, 10 is constant. Because if this is a 6-second strip, and we know that 1 minute has 60 seconds. So if it's 6-second strip, you multiply that by 10 to give you 60 seconds. So that will give you 1 minute. That is why you have to multiply it by 10. Remember, 10 is constant. So if you count, sa counting natin kanina, there are 7 R waves. So you multiply that by 10, that will give you 70 beats per minute. So that is the heart rate of the patient. Now question, is it normal? Yes, it is, because as mentioned, the heart rate is 60 to 100. It's within the range. It is normal. Okay? Now, another way to read the heart rate of the patient, if you don't want to use the 6-second strip, you may use the 6 numbers, the magic numbers. Now, what are those 6 magic numbers? Well, you have your 300, 150, 100, 75, 60 here. 300, 150, 100, 75, 60, 50. So the question here, how will you know the heart rate of the patient with these 6 numbers? Well, remember, I mentioned that the borders of big box are always darkened, right? So the first thing to do here is to choose or look for an R wave that falls directly on a dark line. In short, maghanap ng R wave that falls directly sa dark line. Remember, this is an R wave and it falls directly sa dark line. So this is the R wave you are looking for, right? So this will be your base. Remember, if this is the R wave that falls directly sa dark line, where is the next R wave? The next R wave is this. Am I right? So this is the next R wave after this one. So what are you going to do is that the R wave that falls directly sa dark line is your base. The next dark line, you start counting 300. So R wave that falls directly sa dark line, the next dark line you count 300, 150, 100, okay, sorry, 300, 150, 100, 75, 60. Again, base. The next dark line, 300, 150, 100, 75, 60. Remember, the next R wave is caught in between 60 and 75. That is the heart rate of the patient. 60 to 75 beats per minute. So you have a specific range. But if the R wave falls directly here in the dark line, then the heart rate of the patient is 75 beats per minute. But anyway, it's still normal because the normal is 60 to 100, right? So that is one way to check the heart rate of the patient using an ECG. So there are 2 ways. You may use the 6-second strip, or you may use the 6 magic numbers like your 300, 150, 100, 75, 60, 50. So that's your heart rate. Now let's try to check this one. How will you know, how will you read the ECG of the patient? Now, this is a sample ECG strip. Anyway, andito na yung reading. Okay? So let's identify the waves. So this is the P. This is your Q, R, S, T. P, Q, R, S, T. Now remember, you have to check all the waves. Dapat kompleto yung waves. Kompleto ba? May P wave ba? May QRS ba? May T wave? Yes. Next, you have to check, pareho ba ang interval nilang lahat? Pareho, normal ba ang PR interval? Normal ba ang QRS complex? Remember. Okay, let's try to zoom this one. Okay. Remember that the normal PR interval, okay, will be 3 to 5 small boxes, right? So let's count. 1, 2, 3, 4. Normal PR interval? Yes, normal PR interval. What about QRS complex? Remember, the normal QRS will be 2 to 3 small boxes. Remember, it's 2. Am I right? So it's normal. So you try to check, lahat ba normal ang PR interval? Yes. Lahat ba normal ang QRS complex? Yes. Next, you get a piece of paper. You get a piece of paper and you measure the interval between R and R wave. So let's try to check. R wave and R wave. Right? So you try to check and you move the paper on the other side. Sorry. Pare-pare ba yung distance nila? Yes. Kung pare-pare yung distance nila, ibig sabihin, may rhythm. Am I right? May rhythm. So this is what we call normal sinus rhythm. Why normal? Because the heart rate is 60 to 100. Sir, paano mo nasabing 60 to 100? Remember, this is your 6-second strip. So what is the heart rate of the patient? Again, let's start to count. 1, 2, 3, 4, 5, 6, 7. 7 R waves times 10, that's 70 beats per minute. Sinus rhythm because pare-pare ang interval lahat na R waves, kumpleto ang waves, PQRST, at normal ang PR interval, normal ang QRS complex. Therefore, this is a normal sinus rhythm. But look at this part. Let's try to check. What do you think is the heart rate of the patient? Again, this is a 6-second strip. Let's try to count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13. There are 13 R waves inside your 6-second strip. So if there are 13 R waves, you multiply that by 10, so that will give you 130 beats per minute. Normal? No, that's tachycardia. So we know that this is already tachycardia, right? But let's try to check. Kompleto ba ang mga waves? Yes. The P, Q, R, S, T. P, Q, R, S, T. In short, kompleto lahat. Question, normal ba ang PR interval? Yes, normal. Remember, normal PR interval, 3 to 5 small boxes. Normal ba ang QRS complex? Yes, QRS complex, 2 to 3 small boxes. In short, kompleto lahat na waves. Normal ang PR, normal ang QRS complex. It's just that the heart rate is more than 100. The question, the interval of R and R wave. Let's try to check. R wave, another R wave. So let's try to move. Pareho ba yung distance nila? Pareho ba? Yes, the same. So there is what we call rhythm. So you call this as your sinus, but the heart rate is more than 100. Therefore, this is what we call sinus tachycardia. Now, if the patient is suffering from sinus tachycardia, okay, what do you think are best drugs given to your patient? Well, if you have sinus tachycardia, common drugs given to your patient will be beta blockers, and doctors may also prescribe calcium channel blockers. Remember, beta blockers are drugs ending in olol, just like your metoprolol, propranolol. When you say calcium channel blockers or calcium blockers, these are drugs ending in dipine, right? Okay, one good example of your calcium channel blockers will be your nifedipine. Or remember that calcium, okay, is best absorbed together with vitamin D. So V and D, that's our technique. V stands for verapamil and D stands for diltiazem. So verapamil and diltiazem are example of what we call calcium channel blockers. Now, what about this one? So this is your another tracing, right? So let's try to identify how many R waves are there. So by this time, let's try to check the heart rate without using the 6-second strip. Okay? Yung 6 magic numbers natin. Let's try to use this one. Okay, let's try to use this. An R wave that falls directly sa dark line. Remember, the next dark line you start counting, right? So let's try to count. 300, 150, 100, 75, 60, 50. The R wave falls directly here, and this is 50. So the heart rate of the patient is 50 beats per minute. Remember, the normal heart rate is 60 to 100. If it is 50, definitely the patient is bradycardic or bradycardia, right? So this is bradycardia. Question, kompleto ba yung mga waves? Yes, you have the P wave. Hold on. So you have the P wave, the QRS complex, and the T wave, right? P, Q, R, S, T. So, kompleto siya. Normal din ang PR interval, normal din ang QRS complex. Now, what about the distance of these R waves? Let's try to check. Pare-pareho ba yung distance nila? Yes. So, there is what we call rhythm. Am I right? May rhythm. Ang problema lang, the heart rate is less than 60. Therefore, this tracing is what we call sinus bradycardia. Question, if the patient is having sinus bradycardia, what drug will be given to your patient? Of course, the drug that will be given to your patient is what we call atropine. Remember, atropine is a drug that wherein the effect of atropine is your sympathetic effect. In short, it will increase the heart rate of the patient. Okay, so anyway, that is just a simple clip tutorial about electrocardiography, paying attention on how to read the heart rate of the patient. Okay, so watch out for more video clips because I'll be talking about dysrhythmias. Okay, I'll be talking about dysrhythmias, and pag natapos yung clips, I'll be giving you your, what do you call this, an exam just like this. I want you to identify the heart rate of the patient based on this. I hope you'll be able to get the tracings here. So that will be after, of course, after the videos na ipopost ko in the succeeding days. Okay? So I will let you identify the tracings. Okay? So thank you so much. God bless. And I hope you learned something. Bye!